New York is the new epicenter of COVID-19 outbreak.
America at war with the coronavirus, and President Trump telling the nation, quote, "The enemy is attacking."
There's never been anything like this. And it's vicious. It is vicious.
And now,
According to Global Health Security Index, with a highest score of 83.5, United States stands at the top. That is, the rich, strong, developed America is supposed to be the readiest of nations to face any kind of catastrophic outbreaks. Like China, Singapore, Hong Kong and South Korea administered and successfully fight COVID-19. Well, they had two clear action plans. Firstly, when China realized the seriousness of this matter, they completely, strictly locked down Wuhan and Hubei with no exceptions, even for medical emergencies or personal reasons. The whole world was shocked, and even the epidemiologists warned that this might not work out on a huge population and the economy. But it sounded brutal. However, it was the most effective way to stop the spread of virus. The Americans neglected the warning announcements. Yes, persuading the whole country to stay at home is not an easy task, but things got out of hand very soon.
Still, the governor of New York says he's personally seen parks crowded with people, despite an order that he gave to stay at home.
It's insensitive, it's arrogant, it's self-destructive, it's disrespectful to other people, and it has to stop, and it has to stop.
In China, the government made very clear that the testing and treatment of COVID-19 was absolutely free. Even medical personnel were sent from door to door to investigate, identify the sick persons and isolate them. They even tracked down with all those whom they have contacted earlier. But in other countries, the treatment for corona was still on the hook. An American woman was charged $34,000 for testing and treatment of corona.
Cover the cost of testing for the virus, but then there are three other elements. Firstly, the patient needs to go to a doctor. That will cost $200 to $600. Then there's the issue of CAT scans or X-rays. That will run the cost up to something like $1,000. But this is only the beginning of the expense.
And even at this grim situation, prioritizing economy over the lives of humans is completely unacceptable. This is not a post to frighten you guys, but let this be a wake-up call for the other countries who are at stage 2 or stage 3. Because even the most advanced nation on the face of earth initially neglected the seriousness of this matter, and now they are paying high prices for it. In GCC countries and India, they have already imposed 21 days curfew, but this kind of curfew can only delay the process of climbing the stage from stage 2 to stage 3 or stage 3 to stage 4. But it will not produce an end solution unless and until a complete lockdown and very harsh and brutal actions are taken against the violators.
In stage 1, we say nothing is going to happen.
Stage 2, we say something may be going to happen, but we should do nothing about it.
In stage 3, we say that maybe we should do something about it, but there's nothing we can do.
Stage 4, we say maybe there was something we could have done, but it's too late now.
After the 9/11 attack, the world focused on counterterrorism, and after COVID-19 made the government, medical and pharmaceutical companies concentrate more on public health and welfare. And we as citizens be more responsible and prepare ourselves to fight the after effects with utter confidence and conviction. Who is a superhero? A superhero is the one who has got the extra ability to do things which a normal person fails to do. In the previous video, I mentioned about utilizing the opportunity lying in a hard time to bring the best in you. Here, a country has used this opportunity very well to send their superheroes to other countries for serving humanity and saving the world.
Doctors and nurses from Cuba touched down in Milan on Sunday. They're there to provide support and expertise to the hospitals in Italy, which are increasingly overwhelmed by the number of patients.
Work to do. Fear can be controlled and put to the side. Whoever says that he isn't afraid is a superhero, and we are not superheroes. We are revolutionary doctors.
Yes, Cuba has stepped up to fight the battle against COVID-19 in Italy, Nicaragua, Jamaica and Grenada, and this act of solidarity is highly appreciated amongst the international community. But is this the first time Cuba has stretched their helping hands? Is Cuba really a wealthy nation with a self-sustaining capability? How could Cuba pitch in when the whole world is freaking out of this COVID-19. Cuba, after the historic revolutions led by the legendary revolutionaries Fidel Castro and Che Guevara, faced a strenuous hurdle. There were widespread diseases and the infant mortality rate rose in 1960s. Immediately, he drafted an outline of his aims for the future Cuban healthcare. According to the draft, the government provided high-performance hygienic healthcare for the public, and it also aimed to provide public health services for the greatest possible number of persons. It also funded a program for research and development of preventive medicines. As a result, now the complete healthcare system was rationalized and nationalized. Even today, there are no private hospitals in Cuba, which means every Cuban citizen has the right to standard healthcare protection. With 98% literacy rate and with possibly the largest medical school in the world, Cuba has missioned more than 67,000 medical personnel in more than 60 countries, starting from Brazil and Venezuela to Pakistan and African countries. Cuba has shown the world that how much a nation can do with the limited resources if they focused on the right priorities like health, education, literacy. Let's learn from them.